Hi guys, welcome to Dr. AI YouTube channel. In this video, we are going to talk about scapula. Scapula is a triangle shaped bone and also it is very thin. It's situated from the 2nd to 7th rib level. Here also there are two diagrams, as this is the posterior surface and this is the anterior surface. Posterior surface means this is from the back side and anterior surface means this is from the front side. There are two surfaces in scapula as costal and dorsal. Costal means it is the front side of the scapula. That means anterior side of the scapula is known as costal side. So here there's the subscapular fossa. So it is in the anterior, that means the costal surface, and have three longitudinal ridges. You can see here there are three longitudinal ridges in this costal surface. So the other surface is dorsal surface. That means the posterior surface, the back side of the scapula. It has the spine of the scapula. This is the spine of the scapula. And it divides the surface into two surfaces as supraspinous and infraspinous. Supra means the surface superior to the spine. So this is supraspinous. And inferior to this spine, this surface is known as infraspinous fossa. And these two fossas are connected through sphenoglenoid notch laterally. So this sphenoglenoid notch is situated behind this spine. So I will show it like this. It is behind this spine and that notch is connect these two surfaces. Sphenoglenoid notch. That's all about surfaces in the scapula. So now let's talk about the borders of this scapula. When we talk about the borders of the scapula, there are three borders as superior, lateral and medial. So this is the superior border. This border superior. And this border is the lateral border. Here this is the lateral border. And this border is medial border. So these borders are situated superiorly and these borders lateral mean they are situated far from the medial axis, that means towards the humerus. And these medial borders are situated towards the medial axis of the body, so they are closer to the spine. And this superior border is thin and short. Here the suprascapular notch is present. In here you can see it. The lateral border is thick and at the upper end the infraglenoid tubercle is present. And the medial border is also thin. We can write it as like this. Superior border is thin. And also the medial border is also thin. But the lateral border is thick. And suprascapular notch is situated in superior border and the infraglenoid tubercle is situated in lateral border. Now let's move to the angles of this scapula. There are three types of angles as superior, inferior and lateral. Here this is the superior angle and here this is superior angle and this one is the inferior angle And the lateral angle is this one where the glenoid cavity is present. It is also known as glenoid angle. So these are the three angles present in scapula. So the superior angle is covered by trapezius and the inferior angle is covered by latissimus dorsi, and this moves forward when the arm is adducted. So this lateral angle bears the glenoid cavity. So here you can see that glenoid cavity. So this glenoid cavity is directed forwards laterally and slightly upwards. It's somewhat crema shaped. So now let's talk about the processes of the scapula. There are three main types of processes as spine, acromion and coracoid. This is the spine. You can see it in the posterior surface of scapula. It is a triangular shaped part, and the posterior border is called as the crest of spine. Second one is acromion, and it has an oval facet for the clavicle. Third one is coracoid process. You can see it here. And this is directly inferior to lateral part of the clavicle. So that's all about the scapula. I think you've got a very clear idea about this bone. So if you like this video, please hit the like button and don't forget to subscribe my channel. Thank you guys.